I just would like to quickly start by acknowledging traditional custodians of the land, paying respect to elder past, present, and emerging. Before we begin, I just wanted to definitely everyone is now reflecting on the National Clinical Trial Governance Framework, which identified the need for high-quality clinical trials in order to meet the requirements and also the growth of the clinical trial sector in Australia. In A-CTEC, we acknowledge that the best way to achieve high quality is by establishing and retaining a skilled and reliable workforce across the sector. So this is our ultimate goal for high quality. Unfortunately, there is still a current need to achieve that through a skilled, reliable workforce. However, after reviewing existing data through our committee and also reviewing different educational offerings, the A-CTEC steering committee found that most trial sites are challenged by different elements, including inconsistency in the existing education offerings for their staff, also the variability in quality, accessibility, and most importantly, cost. So what we found that is currently needed is to have equity of access to high quality clinical trials, education and training. Most importantly, to be guided by customized competency frameworks for the different roles in clinical trial to provide clarity of expectations. So the solution that we thought of is establishing A-CTEC, the Australian Clinical Trial Education Centre, through collaborative contribution from clinical trial experts across the Australian health services, medical research institutes and universities. And that initiative was supported initially in Victoria by all of those organizations. And early this year, it went national, where the access has been now provided to all the states across Australia. So our vision actually is to assist the health services to comply with the National Clinical Trial Governance requirements, and also to build the capacity and capability of their staff within the clinical trial workforce. How do we achieve that? We offer education and training that caters various levels of experience and competency across the different settings of the clinical trial workforce, and also across metropolitan, regional, rural Australia, at different settings, hospitals, medical research institutes, or university. We also ensure that A-CTEC offerings are interactive, always up-to-date, practical, multimodal, and evidence-based, mainly providing opportunities for clinical trial workforce to network and share their learnings, and also engage with us in co-designing many of our A-CTEC activities. And that's the beauty of A-CTEC, that we are involving the sector with us throughout our journey. And this is through working collaboratively to share resources and expertise and reduce duplication in the clinical trial education and training efforts across Australia. So whom we are targeting, we are actually targeting all clinical trial professionals in the sector, including the investigators, research staff, like coordinators, research nurses, but also supporting departments like pharmacy, pathology, and other departments involved in providing services to the clinical trial operation team, and also the ethics and governance personnel in the research offices. A-CTEC is actually a dedicated learning management system, and it hosts a suite of evidence-based interactive education opportunities. And our slogan is beyond GCP. It's not GCP is a starting point to be able to get recognized and accredited of your ability to understand what clinical trial responsibility is, but that is actually the starting point. It's not the end point. And this is actually what A-CTEC is offering GCP, yes, but also what's beyond GCP ongoing. So our offerings actually, they range between different education and professional growth opportunities, including self-paced education online courses and resources, problem-solving skills through actual real scenarios that happen at sites, and putting all the GCP principles actually in real action. And also we engage with the audience through different live events and sessions, including monthly webinars and live workshops that are offering training across different elements of running clinical trials. We have lots of professional development and role progressions opportunities as well through the role-based competency frameworks, professional development through community networks, running annual conference every year. And also we offer the career opportunities that currently existing in the health services for people to know what is my next step within the sector. I'd like to emphasize a little bit on the role-based competency frameworks that were developed through A-CTEC, and they are customized to the national context within Australia. So if we look at those competency frameworks as a blueprint for a professional growth and development, we can see the foundation, for example, if you'd like to build a house. So the foundation of the house is, it is what we currently offering through A-CTEC with some trial essential packages to understand and establish background knowledge. And then the frame of the house can be considered as a competency frameworks that are role-based depending on the different roles existing in the clinical trials. And if you'd like to put the doors and the windows, so all the essentials material to build that house, this is our A-CTEC content that is ongoingly continuing and renewing every year as well, depending on the change in the space. In addition to the site experience where people are working. This will require ongoing and non-stopping and continuous growth and development. And this is what we offer again, all the sector, different continued professional development opportunities through A-CTEC across the year. So the essence of our competency frameworks, actually, they identify core areas of practice in clinical trial for each of the roles. They provide detailed skills needed to fulfill those areas, and most importantly, with some examples and tasks on how to meet those ones. So we actually provide that visibility of people how to meet that with some examples. We provide a structured scoring system from a novice to expert. So it's a quantitative assessment as well. So people can actually start to see the progress, not just visually or by verbal discussion, but actually quantitatively. It provides also time frame for assessing the staff, which helps the managers or directors of the research or the manager of the unit to understand actually when to assess. And it can be aligned nicely with the annual review of staff as well, as a very informative tools when you are doing your annual reviews. It incorporates also opportunities for staff to reflect and plan and train and to be exposed to higher levels of skills in the future. So the current ones that are already existing on A-CTEC, and you can easily access them. The one for clinical research coordinator and clinical research nurses, and those are the main core areas. Under each of those core areas, we have sets of competencies, knowledge requirements, abilities, and example of tasks. Similarly to the clinical trial assistant role, where some hospitals, they have that role existing in their clinical trial units. For the investigators, we are relying on the currently existing NHMRC competency for the Australian academic clinical trial. So again, because our vision, we don't want to repeat what's existing, we build on filling the gaps. So we found that this one is still meeting the criteria for investigators, but we are guided by it in terms of the responsibility. What we found was lacking was actually the research office competency framework. There was no clear guidance on what the expectation for someone joining the research office, whether from an ethics or governance perspective. And this is actually one of the achievements that we have done this year through A-CTEC Education Committee Working Group, where we actually developed one that is complying with the National Clinical Trial Governance Framework, and it includes all of those 4 core areas. And hopefully in the future, we are planning in the future to do one for trial pharmacists as well. So if I take into a closer look to the research office competency framework, those are the main core areas, and you can see the different competencies underneath each one. Those found that generic professional skills were lacking in many of those roles. So we provided like a nice framework of what is actually needed as a starting point or developing points to be able to work professionally within the research office. But you will find also we have included core areas related to the integrity compliance training, the committee managements, the different ethics committee managements, and also the institutional risk assessment related to the governance roles as well. It is a very comprehensive document. Under each of those points of competency, we have, again, sets of abilities, the knowledge that is required or expected, and some examples of tasks. So the benefit of actually utilizing those ones or relying on them, it's actually helped any new starter to build their confidence and proficiency and understand their expectation of the role. We understand that professional development is an important thing that people think about. The current position descriptions are most of the time are broad and they don't actually speak much. And having such a detailed competency framework, we have found that they provide people understanding of where I am now and where I would like to go. It also helps the existing team members for their succession planning to identify what their current existing strengths and potential areas for career development and growth. For the research office one, we have provided a suggested diagram of career pathway for the future and taking from the entry level, like the advisor officer's roles, up till the executive director levels in the research office. So we have actually included those roles and what could be expected in terms of competency within that comprehensive document that you will see on A-CTEC. So I'd like to just show you where we are now with our A-CTEC impact across Australia. Now we have reached more than 4,200 users with more than 1,700 interstates. Our participants in live events are really engaged with different activities, and it's beyond the 2,000 now. And we have many enrollments, as you could see, with the number reaching around 9,000 in different courses and activities that are free of charge. Additionally, as well, we had big organization like Peter MacCallum Cancer Center. They have started to mandate the comprehensive package, the essential package in clinical trials to all of the researchers. And we are aware that other organizations as well in rural and regional areas within Victoria are following. And also, as we said, we have already reached out to all the other states, not just Victoria. So as we said, A-CTEC, it's a collaborative effort, and we would like everyone actually to come along with our journey and be part of our bank of experts where we can always touch base. Or if people have valuable really content and they would like to share it with acknowledgement and IP protection, please let us know, contact us. And if you'd like to navigate our site, if you haven't been able to, you can just look at that code and it will take you directly to A-CTEC. So thank you so much for the opportunity today, and I'm pleased to be with you.
That was wonderful. Thanks very much for that. Can you hear me? Yes.
Yes.
Yeah, fantastic. I was wondering, I maybe missed it when you were speaking. Are you anticipating doing a competency or a package for HREC, not just governance, but HREC members themselves?
We haven't done one for HREC members themselves. The one that is already developed is for the research office staff helping the HREC members and also the governance office staff. So if we find that there is an interest for that one, please, Roberta, we would be delighted to work on something like that with experts in the field. Because this is our actually aim. We understand that you cannot provide training or education whatsoever without having some guidance and guided pathway. And we found that having those competency frameworks for the other roles that I showed you helped a lot in guiding where is next we can develop or fill the gap. And it helps as well always the research managers actually to be able to support their staff. So definitely if there is something that is required for the ethics committee members, we'll be very pleased to work with the experts and develop something with A-CTEC.
There's a call for action for
All
everyone.
right. We'll be waiting to hear from everyone, and if anyone is interested to actually be part of development, we'll be keen to do that. We have the capacity to create working groups. So an example that I can say, actually, we have had a webinar and presented the one for research coordinator and research nurses, and we had exactly same interest for, we would like one for clinical trial unit managers. And we said, all right, so let's put it, call for interest. And we had many people interested to develop it. So we formulated in a very short time a working group with experts in the field. And we are currently developing and drafting one for clinical trial unit managers. So it's always addressing the need of the sector. So if we find that definitely there is interest and expertise is reaching to us, we will definitely be able to develop one collaboratively with everyone. And the beauty is that we're across all Australia, so we are not just in one state. All of our members are from all the states, and that's the beauty of our team.